Welcome back, everyone. Now, without any delay, I would like to invite our second panelist. Our second panelist is a fifth-year medical student from Johor, and many of you already know him as a senior who excels brightly, always bringing out such a high-quality performance from academics to sports. Without further ado, please welcome Dr. Tan Chiayang to share his insights.
Thank you, MC Nico, for your introduction. And thank you, DaVinci Club, for inviting me. Thank you, Pengarah Program of this event. Thank you, Harris, and thank you, MPP Bonds. I think I might not be the best person to share my tips with you. Yeah, but I will try my best to share what I think is useful. I think the first presenter, the Chelsea, had a great presentation. She almost covered everything that we seen in during the clinical years. Yeah. So I think we can start the slide. So I think I most probably will share what study tips. Yeah, what are the study tips I think is useful. Slide. And I think my slide will be very simple. And precise. If you have any question, you feel free to ask me and instruct me. Next slide. So I think we need to have a strong basic, as we know that for a building, if you want a building to be let's take a building as an example. We want a building to be strong, then we need to have a strong fundamental. Then we can start to build a strong basics as early as possible. Even in year one, we can start to, build the basics since year one. But take me as an example. During my year one and year two, I don't really know how to study. I only know like study the lecture notes, memorize, and go for exam. And after the exam, I forgot everything. But I think when the years comes, I know that it's not about memorizing; it's about understanding. In order to understand the disease well, we need to have the basic of everything. Like for example, for me, if I want to study a disease, I will start from the anatomy, the physio, the pathology. And one lecture that I really salute to is the Prof. Salim, which I think you guys will meet him when you guys enter year 4 or year 5. He's a associate professor currently teaching the pediatric, which is about the child. His slide is though very lengthy, but include all the important thing. It will the lecture. He will how he teach the lecture. He will start from the basic first. Everything that we have learned throughout the year one and year two, such as the physio, anatomy, pathology. Once we understand the physiopathology, then it's easier for us to understand the disease well. Then we will come out the clinical features, investigation, and management that is useful during the clinical years. Yeah, I think next slide. If you guys have any question, you can feel free to ask me. And second thing that I think is important is we have to be proactive in class and be confident in the hospital. In class means that all the lecturers, they like the two-way interaction. When they ask question, then you try to answer them. If you don't have any question, then you can ask them during the class. Because in, yeah, I think because in clinical years, we have bedside teaching with our internal and also with the external. External lecturers are those invited from the hospital. They are not teaching us directly. They are not our lecturer, but they are the doctors in the hospital. They will take our class for the BST, and that's the time we learn from them. And because the time is very limited, so when we ask more questions from them, then the student are the one that benefit from them. And in clinical years, it's all about self-initiative. Yeah, the doctor, they wouldn't really spoon feed you. That's why you have to be proactive. And in the term of hospital, we have to be proactive. For example, when it comes to some procedure, we can be proactive to ask the nurse, the MA, the HO, the MO, even the specialist. We can ask them whether we can do the procedure, like the simple procedure like the NG tube insertion. We do the urinary catheter, the taking blood from the patient. If you approach them, definitely they will allow you to help them. So be proactive in even in the hospital. Yeah, next slide. Yeah, I think another important thing that I realize is the consistency is more important than the intensity. Consistency means that for the study, medical school is like a marathon. We cannot finish it in one time. We have to. It's a lifelong journey. So including the study. So we have to be consistent. For example, we can take every day. We can take 1 to 2 hours to study instead of before the exam we study 24 hours for that. And yeah, so to be consistent. Next slide. These are the healthy habits that I think everyone should have that. First is the get enough sleep. For me, I will sleep at least 7 to 8 hours every day, even before the exam. Because if I didn't sleep enough during the exam, for the clinical exam, it's not like theory. It's you clock the patient, then you present to the doctor. You have half hours. You have to deal with the lecturers. It's not that like theory exam. Only uh you only uh, see the question and then answer, write it down. But in clinical, it's like you have nothing with you, only the knowledge. Your you have to answer all the questions from the lecturers. That's why for me, I think that sleep will is very important even before the exam. If I didn't sleep well, the next day I will feel very fatigued. My brain can't function well. And for the sleep, also statistics will show that sleep we divide into the REM and non-REM. The sleep is important for our memory formation. That's why it's, it's better to have enough sleep. And secondly, we have to eat healthy food and then exercise regularly. For me, during when it comes to evening time, after I study, I know that I can't study anymore. Then I will rather I go for exercise, go jogging, or go play sports with my friend. Yeah. Next slide. Another thing is I think we have to use the reliable resources. There are few references out there. For example, we can use some medical reference book. Nowadays we all have ebooks, so it's make us easy. We don't need to carry a lot of heavy books. The second is the up to date. For me, I rarely use that, but I rarely use it. But some of my friends they are using it. And the third one is the emboss. I think maybe some of you have no idea what is emboss, and I strongly recommend you guys to use the emboss. Although I'm not the ambassador for the emboss, emboss this app is one of the in UKM. In UKM, their faculty provide them the free access to all the medical students in UKM for the emboss. Emboss it contain all the basic. It will start from the basic and then go deeper. It will include the investigation, clinical features, management, and everything for each of the disease. And for me, I think this is quite useful. If you are capable, you can subscribe it. If you are not capable, you can go and Shopee and buy the subscription from others. And you can look it up for the emboss. Strongly recommended for you. Next slide. Oh, moving on. To continue the medical reference book, for me, I don't really like to read the note. Note means that it's in the point form because I'm the type of person that likes uh, to understand everything. I will be curious why this happened, why that happened. If I'm reading the note that's written by someone, I don't really understand. I can't link the first sentence and the second sentence. That's why I prefer to read the medical books. because medical books will clearly explain everything step by step, so I can link everything well. Yeah. The next thing is sharing and teaching. I think this is also important. We can we don't feel selfish to share the knowledge in hospital in class to your group mate. You can also feel free to teach your group mates if they don't understand anything, because when you teach them, you will you will understand whether you really understand that topic or that disease or not. And when you teach them, it can enhance your memory understanding as well. Yeah, as well. Next slide. And I think the last thing is the practice makes perfect. For me, if I go to hospital and glad that I have a great group mate, because among my group mate we will set one target. For example, today we go to hospital, we have to practice the job case, because as you know, we have a lot of job case, a lot of system to practice, and we have to pick up the sign as well. But to familiar with the skills, we need to practice. Then among my group mate, we'll set one target. Okay, today, every one of us, maybe five of us, we have to practice one system. Then other friends will observe you practice in front of them. Then you can try to present to them, present the findings, the investigation management, so differential diagnosis. Then you guys can discuss. So another thing that my group was doing is my group will in clinical years, the doctor will expect us to know all the values. Like for example, the value for the sodium level in our blood, we have to memorize it around 135 to 145. This uh memorizing is not by what is only one day. Rome is not built by one day. It needs like practices. So my group will every day we will like keep asking each other question like what is the normal value for what for certain thing. So it can help us for our memorization and for our knowledge. Another thing is for the, I think for occultation of the murmur, I think this is one of the challenging part for all the medical students, including me. One thing that I'm practicing last time was I always, when I wake up, then I will auscultate my own heart, because I will, when you used to listening to the when you used to listening to the normal heart sound, when in the hospital, when you see the real patient, when it's counted, then you will find out it's abnormal. Then you can find the findings. Yeah, I think that's the sharing for me. And I believe all of you have the potential to be to get distinction in your exam as well. Any question, feel free to ask me.
A big thank you to Dr. Tan Chayang for the insightful talk. Your journey is really inspiring, and we appreciate your time and effort in being here today. We will now proceed with the Q&A session. Please don't hesitate to forward any questions by turning on your microphone or simply type them in the chat box.
Hello. So I have a question here. So my question is, we know that preclinical and clinical is a different, right? So how you guys actually overcome the stress in clinical year?
Thank you, Pons, for your question. I think your question is you said you asked about the clinical and preclinical is different. How do we manage the stress? Is it?
Yes.
Yeah, I think yeah, it's normal for all of us to feel stress in the medical school. For me, how I manage the stress is I will do workout every day. This is my way to relieve the stress. And I think everyone have their own way to relieve their stress. And most importantly, that we think don't stress out. If you have any concern or any question, you feel free to reach out to your support system with your family, your friends, your housemate, your group mate, and even your lecturers. I think all of the lecturers of UMS, I think they are quite nice and they are willing to help us. Yeah, find your own way to relieve the stress. I think there's one question in the chat box. Okay, how I balance the question is how I balance the timetable for study and also get enough sleep. For me, even though yeah, I really understand that the clinical year is very challenging, and even for us, we have to travel to the hospital. It takes a lot of time, maybe 1 to 2 hours daily. And sometimes because of the traffic jam, it takes a lot of time. At the same time, when we go back home or get back home from the hospital, it's quite late already. Then we have to prepare for the next day bedside teaching. This is quite tiring. I understand that. And how I balance that is maybe without ignoring all the co-curriculum like the class and also sports, I will try to squeeze time to have a self-study and get enough sleep. Yeah. And how long for the I hope I understand. I answer your question. For the second question, how long does it take to fully adapt to clinical year? 1 year enough or more than that? For me, when I first enter year 3, I really lost. I don't know how to clock a patient, even though even though there are lecturers that guide us, but history taking is not that easy. History taking is an art and it's not an easy. Everyone has different style for the history taking, and even all the lecturers they have different expectations from the history of you. So I think we have to find a way. I think you can approach your senior, your buddy, your graduate buddy, year 4, year 5 buddies. You can ask them how to clock a history. Even if you want to approach me to know how to clock a history, yeah, I'm okay to tell you how to clock a history. And I think how long does it take to fully adapt to clinical years? It depends on everyone. Some people they adapt very fast. Some even it takes years for them to adapt. I think try your best to adapt and don't forget your senior is a strong support to you. Feel free to approach any of them. I think they are willing to help you. In your, I think I answered the second question. And moving on to the third question. In your opinion, is it a must to have an iPad as a clinical student, or it just an optional? For me, it depends also. Some of my friends, they are using iPad, some they are not using. For me, I'm using that because I can use the ebook from my iPad. Some people, they just use their laptop. It's just fine. And I personally, I prefer I prefer the handwriting as compared to the writing on the iPad, but because of the convenience, so I I own an iPad for that. I think
Hello.
someone is asking about the sister. Yeah.
Okay, so for the question from Huge House, actually I'm still adapting to the clinical year, but as for me, saya rasa the first posting sejak yang saya feel like imposter syndrome, but the second and the third posting I'm adapting well. Just itulah, dia depends on people lah. It depends kalau you adapt to the environment quickly or not. So that's why it is important to ask your buddy, ask your senior doctors, even the HO yang kamu kenal di hospital lah. Yes. Is that answering your question, Huge House? Okay, thank you.
I think Aisha is asking is there any kits that we should prepare for the pediatric posting? For the kits, do it means that pediatric kits or any tips that we should prepare for pediatric posting? For the kids, I think the pediatric kits is necessary for all of us. If you don't have, I think you can borrow from your body because we will use that for the developmental assessment of a child. Even that can come up as a exam during the clinical years. The doctor, in short case, they will ask you to perform developmental assessment in front of them. Then you have to use the pediatric kits to do the assessment in front of them. Or if you want to buy, I think you can also buy on Shopee. Yeah, pediatric kits selling on the Shopee. I hope I answer your question. Ahmad is asking, how do you handle a situation where different doctors give conflicting instruction or ways of examining the patients? I think I quite understand you because all the lecturers, they have their own style of examining the patient. Even in FPSK, they have their own style. During the exam, there are external examiner that comes from the KKM, which is they are not teaching us, but they are doing service in the hospital. They will be our examiner. So if each of them have their own style. For me, I also have that. I also have that concern. So when I see one doctor, I have to prepare for the style for that certain doctor, and other doctor have to prepare their own way. But you have to make sure that the way they are using are correct, and also the way you are performing is the correct one. I think they have their own reason for that way. I think any method might be is correct. And all the methods of our lecturers teaching us is correct. Then we have to know the reason why they are doing that. Perhaps you can next time if they are doing different method, perhaps you can try to find the reason why they are doing that, or you can try to ask them. I understand your situation because this happens to all the students in FPSK as well. I hope I answer your question, Ahmad. And the next question is, what are the important traits that the clinical lecturer wants to see in clinical student? I think the important traits or characteristic, I think, is being proactive. Some lecturers, they really don't like their class to be passive. They like the interacting way of teaching in the class. And some lecturers, they prefer the student to be humble, and also sometimes they want the student to be confident. And also I think the time being punctuality is one of the important thing that all the students should have. And being responsible is one of the important traits that I think all the clinical students should have. I think there are other questions for Sister Chasi.
I want to add something for Huzaifa punya question. Actually ini benda dia memang common. I think every posting untuk third year punya posting also got something like this lah. For example, for ONG, some doctor bila buat obstetric punya examination, diorang tidak recommend buat deep palpation. Sebab once kau buat deep palpation di obstetric punya patient, diorang akan anggap kau buat gynecological punya examination and automatic akan gagal. Tapi ada doktor, diorang buat itu doktor dia buat deep palpation which is a bit shocking. Tapi for ONG, you just use the standardized one punya obs examination lah. As for the medical, because medical got external lecturer and also internal lecturer kan. And mostly the external one, they got their own ways of doing examination. For example, external examination, dorang mau buat check for splenomegaly, itu external tu dorang akan buat J shape. Tapi as for our internal, dorang prefer diagonally punya cara. Jadi kalau time exam, bila kamu masuk itu bilik, kamu make sure kamu buat examination based on apa itu doktor prefer. Ini benda ada betul-betul berlaku bila saya buat examination short case dan clinical. Saya buat cara doktor internal. Doktor ni internal cakap, kamu buat ini punya cara, yang sensation tu paling last. Sebab sensation tu banyak sikit mau buat untuk neuro examination. Tapi saya dapat term tu adalah external. Dan external ini sangat strict. Dia mesti ikut flow yang betul-betul standardized. Dan time feedback session after EOP tu kena komen lah yang macam kenapa neuro examination ni tidak betul gitu. Jadi make sure when you find someone, lecturer itu di bilik itu, kamu buat macam mana lecturer itu mau. Kalau surgical pula, kalau surgeon, dorang buat thyroid untuk tengok retrosternal extension, dorang akan buat di lateral sikit, di intercostal space. Tapi kalau untuk ENT punya doktor, dorang akan prefer buat di sternum. Kasih terbalik. Tapi lebih kurang begitulah. Dorang tidak sama. Jadi based on doktor kamu dapat connection itulah. Jadi tengoklah. Soalnya external ni dorang ada cara dorang tersendiri berbanding internal. Tapi dahulukan cara internal lah sebab dorang ni lecturer kita. Dan most likely kita akan jumpa dorang time kita exam. Okay, so untuk question Nicole, transition from preclinical to clinical easy ke tidak? Saya rasa susah sebab saya ni seorang introvert sebenarnya. Saya sebenarnya pemalu. Jadi saya time kami di hospital kan kami macam takut-takut mau tanya. Jadi sangat susah mau approach. Saya rasa time clinical year ni setiap hari saya perlu bersosial dan itu susah untuk saya. Lecturer prepare you guys what to come. Dia dah bagi ke? Tak tahu sangat tapi basically student yang akan adapt everything lah. Doktor akan dong tidak kisah juga actually tu. Dong yang penting kamu di kelas dorang saja. Yeah. Okay. Next question. Any kid, neuro kid, I think apa-apa yang kit yang preclinical ni semua pun ada juga sudah preclinical macam tendon hammer, neuro kit, measuring tape, stethoscope, pentorch. Yeah, I think that juga berubah. Explain the structure in clinical year. Okay, maybe ini Dr. Tan Chia yang boleh jawab. Terima kasih.
Thank you, Chelsea. I think just now you mentioned about the ONG different way of examining the patient. At first, I also have that concern as well, but when it comes, when I enter year 5, I start to realize why that specific lecturer, they have their own way of examining the patient. Because in some cases, in some of the pregnant obstetric case, the pregnancy, the mother, the abdomen is not that big, and there is no signs of pregnancy. There's no pregnancy sign that we can see, and we will think that this is not pregnancy. We'll proceed with a gynecological examination. The way that we have to do the deep palpation, I know I'm not encouraging you to do that, or not encouraging or not discouraging you, but I know the reason why the doctor want us to do that is because they don't want us to miss this is pregnancy or this. They don't want us to confuse between obs and gynecological, because there are some patients that the abdomen is really small. We cannot really differentiating them unless we palpate them. Some patients that don't have the pregnancy signs, because in short case, if we confused between the obs and gynae, we will fail that station. So the purpose of that doctor doing that is don't want us to get confused. But yeah, for me, I will still doing the examination depends on what the doctor is in front of me. Yeah, I think this is what I understand when I enter year 5 for that different approach of examining the patient. And I think Yuva is asking any kits that we need to buy or have before starting clinical years for year 3. From what I have is in year 3, in year 3, you'll have only surgery, ONG, and also the medical posting, stethoscope, monofilament, neuro kits, peanut stethoscope, measuring that, pen torch. I think these are necessary for year 3. When it comes to year 4, for the pediatric posting, extra thing that you need to buy is the pediatric kit. And there are seniors selling the second-hand item on WhatsApp group. I think you can join them. If you found anything that you need, then you can buy from them. Explain Haris is asking the exam structure in the clinical year, and you guys have no experience with the Viva. For the exam structure in clinical years, for each posting, we have theory and also a clinical part. For the theory, is like OBA, single best answer, MEQ, LEQ. Then clinical, we have the OSCE, and also the clinical is the long case, short case, and then the Viva. For the Viva part is like the assessment is to assess what you have signed in logbook and your experience throughout the posting. Depends on the doctor. Some doctor they will throw random question to use, or they will ask you the question in the logbook. If you have signed let's say in the logbook you are required to do the urinary catheterization, and you have signed for that. In the Viva, you might encounter the question about that procedure. For example, the doctor might ask you, okay, tell me how you perform that procedure, how you perform urinary catheter, or how you have seen the procedure, right? Tell me about that. Then they might ask you about the contraindication of doing that, in complication of doing that, indication of doing the procedure. So everything you have signed in the logbook, you have the responsibility to study for that and to be answered during the Viva. For the theory part, I think it's the same for LQ, MEQ, and OBA. For the clinical, this is quite challenging for all the students because you have no paper, you have to face the examiner. This will make us tense up. For the short case, it's around 10 minutes. Then you examine the patient for 7 minutes in front of the lecturers. You have no idea what case you will get. Then 3 minutes is for your presentation. And for the long case is 1 hour, you clock the patient. You have the patient with you. Either it will be conducted in hospital or in faculty. 1 hour, you clock the patient, you ask everything that you need for the history taking. Then you do the physical examination. During that time, you have to arrange your history well and present for the next 30 minutes. For the next 30 minutes, the lecturer will listen to your presentation, the history that you have clubbed, and the physical examination that you have examined on the patient. Then they will throw the question on you, like investigation, management, and differential diagnosis. For the history tech, for the 1 hour, for everyone have different style, but for me, try to practice history taking in 30 minutes. Then you examine the patient. Then you rearrange the history. You arrange the history, and then you try to figure out the differential investigation and management before the lecture come in. Yeah, I know in the beginning the history taking might take time for everyone. Is understandable. When the times goes, you will catch up the way to really to know how to plot a patient. I think I answer your question for the exam structure and clinical year. Mm, Rajesh is asking, being a clinical student, does it limit our capacity to be active in club or organization? I would say it does not limit our capability because one of my batchmate, Roslan, I think all of you know, or you know him. He's the he's the MVP of UMS last time, and he is also at the same time he is trying to balance between the extra curriculum and also the curriculum. I think he did a good job in that. If you have anything, I think you can also try to approach Roslan for any advice from him. I hope I answer your question, Rajesh. Yeah, I think Chelsea, you have anything to add on?
Untuk menjawab soalan Rajesh, sebab untuk session ni saya menjadi presiden and at the same time saya ada PE1. Honestly, saya rasa dia tidak affect pun sebab if you got like manage your time wisely, saya rasa tidak ada masalah untuk pergi belajar dan juga berkelab dan beraktiviti macam biasalah. Sebab banyak je senior-senior kita yang sudah ada kelab aktif, ber-MPP, berprogram sana sini pun diorang masih boleh survive medical school diorang lah. Jadi saya rasa diorang tidak affect apa-apa pun dalam pembelajaran as a medical student. Okay, itu je.
Shall we proceed to the next question? I think the next question asks about the how do on-call situation work. Our on-call as a medical student is different from on-call as a doctor in the hospital. Our on-call is only until the 10 p.m., but this is different from those who are really working in the hospital because if they are on call, they have to work for 1 day for their morning shift and then continue for the night shift on call, then continue to work the next day. This is their on call, but for our on call, we only have to stay in the hospital until 10 p.m. or sometimes we go during the weekend. This is how the on call works. And during the on call, we can see if you stay in the hospital, we can see the fresh case that being admitted to the hospital. You can also have more time to learn from the doctor because the is less crowded during the on-call time. Less people, you have more opportunity to do the procedure. You can help the doctor to take the blood, fill up the form, and do some simple procedure from them. What's the worst case scenario that you have experienced? This one, I don't really have a worst case scenario, but I think it's you will stay in the hospital till very late. Sometimes when you are attached to a specific lecturer, if they are on call, you have to follow them. Then for them to have a walk round even until 10, 11 p.m. If they didn't go back, they also cannot go back. Yeah. I think I enjoy the moment of having on call as a medical student last time. Yeah. Although I'm still a medical student, I hope I answer your question. And proceed to the next question. Amalin, if Chelsea, you have anything to add on, you feel free to interrupt me. How many days gap before starting the next new posting? For year 3, 4, 5, I think we will have only 1 week break before we proceed to the next posting, meaning that when we finish our exam, the next week we have 1 week break, and then this will follow by a new posting. So try to enjoy the best during holidays and during the pre-clinical years. The next question from Azira is, have you guys experienced getting scolded by patient? If yes, how did you handle the situation? I think it's normal to be scolded by doctors or by lecturers or by the patient. Maybe they are less likely they will scold us, but what I felt is the patient is annoyed when we want to examine them, because in the hospital, when a patient have a good finding, all the student will go and try to examine, try to appreciate the finding. The patient will feel annoyed. I think you can try to explain them to them well, nicely. They will understand and they are okay with that. Another situation that I have seen in my group is in the clinic. During that time, our lecturer want us to clock a patient and then present the case to the lecturer as a real doctor, but the patient is like, oh, she think she see you as a student, she doesn't trust you, then she feels like they don't want to answer the question, they don't want to answer you, they don't want to cooperate well with you. I think you can feel free to reach out to a lecturer, and luckily, thankfully, the lecturer is with the student. Our lecturer tells the patient that the medical student will be a future doctor for them. If you didn't let them to clock you to practice to examine you, then future they might be the one who see you and they might have make some mistake or didn't learn enough from you. Yeah, and luckily the patient is okay for that. Yeah, if you have anything, I think you can feel free to reach out to your lecturers. I hope I answer your question, Azira. For the next question is Aisha asking about any tips for clinic session. Clinic sessions depends. Our role actually is to because in hospital, in the ward patient and clinic patients, there are two totally different patients. In the ward patient, they are mostly acute case. They are maybe having the myocardial infarction or we said heart attack, then they are being admitted to hospital. But in clinic case, they are mostly chronic and stable patient. Then if we have to be rushing to go to the clinic as well and as go to the ward, because our exam is conducted. The patient bank for our exam for P2 is mostly stable patient. Those acute case you seen in the hospital, they won't come out for our PE2, but they will come out in our end of posting exam. And the patient, there are nothing said that only hospital ward patient are important, clinic patient are not important. Both are equally important. So, and for the, yeah, we have to rush in to go both of them. Any tips for that? I think you can try to approach the doctor that's willing to teach you. You try to stick with the doctors, then feel free to ask them any question, even though they are busy seeing the patient and we might only stand beside watching them. You can try to see how they work, how they handle the patient, how they manage the patient. And if possible, you can clock the patient, and then you can know the story of that, and then you present to that doctor. Yeah, I hope I answer your question, Aisha. Another question is, what are the things that you wish you know before entering the clinical years? I would say basic, basic of the knowledge, because I only start knowing how to study when I enter the clinical years. If I have known how to study properly, how to study the physio and pathology properly during year 2, then this might help me during my clinical years to understand the disease well. If during preclinical years I only memorize the lecture note, then I go for exam without really understand that. If I have known earlier, I would have started to read the medical books about the physio and patho, but I didn't ask you to read everything. I know there are a lot of things to read, but you can choose. You have to choose wisely what you have to read instead of reading everything. Yeah, build a strong basic of knowledge and be confident when you enter the clinical years. If you have any opportunity to do any procedure, you just feel free to offer yourself. You can just raise hand, or you can just offer to the doctor that you want to do that procedure. I think this will benefit you a lot. I hope I answer your question. And there's one more question about the order of posting. Can we choose that? The answer is no. It's up to our year coordinator, which is the lecturer. They will they will send you a name list for each posting you will enter when you enter the clinical years. Yeah, I hope I answer all the questions. Nico, our MC Nico is asking, how did you know which information you had to focus on when you were reading the visual and pathological books? For last time, I didn't really read the Gaitan, Ganong. I think because I don't know how good are them. So but I start to build my basic when I enter the clinical years by using the emboss the apps, because in that apps it will tell for example, the acute appendicitis. This is a very common case that we will see in surgical posting. When we know, then when I study the acute appendicitis, I will first go and study the anatomy of appendix. What is appendix? Where is from? And then the structure, not the structure of that, the large intestine, appendix, how to identify appendix during surgery, and then proceed to the pathophysiology, how the acute appendicitis will cause the symptom. Like for example, it will cause at first, why there's a radiating pain from umbilicus to the right iliac fossa pain. There's a reason behind that. I think if we go and study the pathophysio, it can explain everything. Why there's a radiating pain. When we do the examination for acute appendicitis, there are specific tests we have to do, and there are also reason behind that why we have to do. Instead of just memorizing everything, the appendicitis to presented with nausea, vomiting, abdominal pain, we can understand why this kind of thing happens. I think this is the miracle of medical school, and also the knowledge that make me to have the interest in studying that. I like to know why this happened, why that happened. I think this is interesting if you really go and read out what is happening behind that. I hope I answer your question, Nicole. And for the Pengara program is asking how much I read overall medical school experience of 10. I will definitely read 9.5 because I really enjoy the medical school since year 1 until year 5. And also thank you to the Mestas, AMSA, and also DaVinci, all the club in UMS, in FPSK. They are, other than organizing the curriculum activity, they also organize some sports day, some event for us to join. So I really enjoy them. And why I didn't give 0.5, I think it's the transportation issue. If you enter clinical years, you will suffer traffic jam every day. If you want to go to HQE from UMS, it will take around maybe half an hour, depends on your location. You have to try to avoid the traffic jam every day. You have to be headed, thinking about sticking in the traffic jam every day. So I'm unluckily all the juniors here. Next year, the hospital EMS will be officially launched, will start their operation. And I think this is future benefits that one of the benefits that our futures junior will have that benefit from. Because you guys no need to travel far to the hospital, HQE or HQE2, you guys can just utilize the hospital UMS as much as possible. Yeah. Think I think I hope I answer your question. Anna is asking, can I know how can we make the most out of word round or any sessions? Any tips for this from the word rounds? Yes, I think it depends because sometimes, to be honest, sometimes also there are sometimes we will really learn a lot from the word round, but sometimes the learning points are less for us as a medical student. How can we make the most is I think we can try to see instead of just following the round, we can try to see the case, what is the case, and how the doctor manage them and why they are doing that for a specific reason. And feel free to ask all the lecturers. I think the some of the lecturers will ask us to follow them in the morning, and they are lecturers and they are willing to teach and answer all of our questions. Even simple question, I think you can, if you have any doubt, feel free to ask them. I hope I answer your question, Anna. And the next question is, if I'm not mistaken, we have the requirement of 20 CPD points per year during clinical years, right? How did you manage that? I think the 20, it 20, 20 CPD points seems is very difficult to get that. Actually, when you enter clinical years, easy to, it's very easy to get that. When you join I think all of you no need to be stressed about the CPD point. When you join any activities organized by the club in FPSK and accumulate that, you can achieve that easily in the end of the years. Just one tip is once you join an activity, remember to list them down because in the end of the year, you will forget what activity you have joined. So better you list them up every time after you join an event. Yeah, so it's easy to accumulate 20 points. I think that's all for the question, right? I hope I answer your question.
Thank you to both our panelists. Their sharing has been so informative and exciting to listen to. I hope it was the same for everyone as well. So now, I want to remind everyone once again before we end our session, please fill in your attendance using the link or QR code provided in the chat box. This is to ensure that your certificates are to be completed in a swift process. Thank you. Unfortunately, we have come to the end of our sharing. We want to express our sincerest hope that the insights and experiences shared today have been beneficial to you. We extend our sincerest appreciation to each participant and not to forget the panels for taking time to be with us today. On behalf of the organizing committee, we would like to apologize for any mistakes throughout the event. Before the end of our we would like to invite everyone for a photography session to make lasting memories for the day. Please consider turning on your camera and ensuring your camera ready. Your participation